What causes borderline personality disorder? Here to answer that question is leading clinical psychologist, Dr. Ramani.
Everybody wants to know, with such a complicated clinical condition like borderline personality disorder, how did this happen? That's always the million-dollar question with any mental illness, frankly. And if you look at the work of Dr. Marsha Linehan, who's done a lot of the research in this area, a lot of her work and other people's work highlights this idea that it's two things coming together: a biological vulnerability and coming from an invalidating early environment. So the biological vulnerability part, that part we're not entirely clear what that's about. Is it genetic? Is it a neurotransmitter issue? But something biologically about that person has resulted in them being more hyperreactive. They sort of overreact with emotion, with sadness, with anger. That couples with coming from an early environment, usually a family environment, that's very invalidating, where people are downright hostile, abusive, negating, critical, in a chronic way. Listen, no parent gets it right every time. This is the majority of the time. That environment is invalidating, and you can see how that becomes a setup for assuming that all environments are going to be invalidating. So there's this sort of hyper overreaction in the face of that. Now, where this work gets interesting is not everybody who comes from an invalidating environment develops borderline personality disorder.
That was my next question.
And not everyone who has that biological vulnerability develops borderline personality disorder. Obviously, if you have both, the probability goes way up. Now, an example of sort of the most extreme invalidating early environment is sexual abuse, childhood sexual abuse, right? That is an example where the child's trust is betrayed, they're confused, no one's keeping the child safe. However, the majority of people who experience childhood sexual abuse do not go on to develop borderline personality disorder, and a lot of people with borderline personality disorder did not experience sexual abuse as a child. So there's no absolutes here. And I think that frustrates people because everyone wants a slam dunk.
I was just about to say that.
Yeah.
I am frustrated just listening to that.
Yeah, it is. So whenever we sort of uncoil or unspool the history of somebody with borderline personality disorder, we definitely see that something wasn't quite right in that early environment in most cases. But I gotta tell you, the longer I'm in this field, the more I hear tales of people who have borderline personality as adults. I've worked with the parents, and they'll say, listen, we have racked our brains. And this is multiple people. So it's not like one person could be deceiving and hiding this. And there's just no story there. There's no neglect, there's no abuse, there's no bullying, like there's no smoking gun. So it really then comes down to, in those cases, it probably was all biological vulnerability. The research right now is focusing on uncovering what that biological vulnerability is. Remember, as with all mental illnesses, the earlier we can intervene, the better the work we can do. So if we could identify some of these early soft signs, we might be able to work with people to give them better coping skills, particularly around managing emotion.
Yes, and that is a common thread with all of the mental health issues we've been talking about. Early intervention and intense intervention is the key to almost anything.
Especially, and we often miss these things in childhood. That's where it gets tricky. For a lot of people, these patterns were apparent even in late childhood, early adolescence, but nobody really jumped on it until they were well into adulthood.
Or they say, well, yeah, he's 16, 16 so of course he'll grow out of it. But if we don't know the biological component that could be causing this, the only way we're coming to that conclusion is by saying that everything else can't be the cause, so it must be a biological cause.
If there's no other historical kind of an issue that comes up. I mean, listen, we are born with a temperament. Ask any parent out there, especially a parent who has multiple children, they'll say, one kid was a really easy baby, and they went on to become an easy grown-up, and they had that kid who was clenched up from the day they were born, and they were clenched up as adults. We do have temperaments, and there may be more vulnerable temperaments, which are believed to be biological in origin too. Until we can really unravel this, we're not going to know until, again, these behavioral patterns emerge. But what this also speaks to, though, is what we can do is hedge our bets. This means things like teaching people to parent. That, sometimes under a lot of stress, parenting is hard. This is not meant at all to blame parents, but it's really about ensuring that we have supports in place for parents, whether that's daycare, whether that's parent training, whether that's pediatricians and other medical professionals that work with parents so they can be the best parent possible. We put a lot of pressure on parents as individuals when really as communities we can be drawing together and supporting parents, especially parents who are in more vulnerable situations, high stress, job insecurity, other mental health issues. We should be supporting parents because that allows them to support kids.
We put a lot of pressure on them and then no tools.
And no tools, exactly. And the importance of creating very validating early environments for children at home, at school, that children need to hear day in and day out, you're okay. You're not just okay, you're terrific. Pay attention to them. However, you can do all of that. And a person can still develop borderline personality disorder. So that's where this gets tricky.
And you know what? I also like to hear that, and I'm not 3 years old either. I like to hear I'm terrific too.
That's right.
So, that just it's there. It can't be understated of being a good person. Be a good person, and that will always help. Dr. Ramani, I was looking on YouTube, and a lot of people are out there claiming and talking about having or experiencing a BPD episode. Is that the right terminology, and what are they referring to?
I think that in the world of mental health, we have sort of what we talk about in what we as practitioners talk about, and then there's the experience of the people who are living with the disorder. So I don't ever want to say, oh, you're saying something that's incorrect, but I also think for people who are watching it, what it likely means is that at a time of it, because it's not an episodic illness per se, right? So borderline personality disorder, like all personality disorders, there's a constancy to it. But there are times when that borderline personality style can result in periods of really having a ramp up where you're triggered. And that could be manifested by rage. That could be manifested by a sense of almost panic. A person almost looking disoriented. So the people watching this person will say, what the heck is going on? This is not the person I was just talking to.
Right.
So the idea of an episode is really the sense of that the person with borderline personality is going about their life, and then something, a conflict, a trigger, a stressor happens, and then they have a reaction to it. We do know that borderline personality is characterized by often disproportionate reactions to triggers and stimuli. And the people who have borderline personality will be the first to acknowledge it, saying, yeah, that was probably too much. I just couldn't help myself. Yes. They feel that there's no other way to respond in that moment. And so that is what is meant by the episode. But the episode itself is not a clinical term.
Right.
It's not something we track and say, oh, we're looking for certain kinds of episodes. It's likely that a person who's dysregulated like this will have a moment, an episode, if you will, where they're hyperreacting, but it's not an episodic illness by definition.
Now on YouTube, you have addressed the 9 traits of borderline personality disorder, where the DSM is taking how we diagnose and how we meet that criteria. Now, it's too long to get into for a YouTube clip, but can you give them a little more information on what we covered in the series as it relates to the DSM?
So, these newer models that look at how the person's personality functions both in the realm of themselves and in how they interact with other people, and sort of where their vulnerabilities are in terms of how their identity, their own self-direction, empathy in their world, and intimacy. And then we also talk about the kinds of traits associated with personality disorders, such as borderline personality. There are 5 traits that the DSM talks about that are potentially problematic if we have a higher level of those traits, and how those get in the way, and those specific patterns in borderline personality related to negative emotionality, being impulsive or disinhibited, and in terms of being antagonistic or somewhat hostile at times.